Hello everyone, my name is Jack Hemphill. I'm a project coordinator at Rutgers, the State University of New Jersey, and co-investigator of the pilot project I'll be discussing today. So the title of our pilot is a pilot implementation of a student patient navigator program to promote breast cancer screening among low acuity emergency department patients. This project is led by our PI, Dr. Humera Chaudhry, who is the chair of radiology at the Rutgers, New Jersey Medical School in Newark. And you can also see our other team members listed here. And this project is sponsored by the Department of Emergency Medicine, also at New Jersey Medical School. The purpose of our project was to design and implement a pilot student-patient navigator program within the University Hospital Newark Emergency Department Fast Track. So University Hospital Newark is a safety net hospital located in Newark and is a primary teaching hospital for Rutgers, New Jersey Medical School. The purpose of our program and project was really to assess its effectiveness in coordinating breast cancer screening appointments for low acuity vulnerable female patients. So for background, numerous studies have shown that COVID-19 has led to significant decreases in breast cancer screening rates and has a significant impact, especially among racial and ethnic minorities, such as Black and Hispanics, with low utilization of screening mammography when compared to non-Hispanic white populations. And this is especially significant because when we looked at our ED patient demographic population in 2021, we saw that more than half of the population was Black or African American, and 37% were Hispanic or Latino, which again shows a significant group that have poor outcomes for screening mammography. Furthermore, also looking at the data just in general, the number of screening mammograms in this bar graph, you can see that there's a 26% decrease in number of screening mammograms from 2019 to 2020. And so our goal was really to help improve screening mammography adherence and screening mammogram value. So the pilot design, first off, the project was funded by Screen New Jersey, which is a cancer screening program, and also the POSEN grant, which provides funding to New Jersey medical school research projects. Our pilot goal was to navigate screening mammogram appointments for 30 patients that visited the emergency department. And to do this, we recruited and trained health profession students as patient navigators, and their job was to identify eligible low acuity female patients in the ED fast track to help provide screening mammogram appointments navigation to them, again, following the American College of Radiology breast cancer screening mammogram guidelines. Students provide education, also confirm patient eligibility for a breast cancer screening mammogram. They then help schedule appointments and confirm financial coverage for the patients to make sure they did not have to cover the cost of the screening mammogram. We also offered transportation via Uber Health to the patients if they needed assistance. And we also offered $25 gift card incentives to patients that showed up for a screening mammogram appointment, all of which was funded by Screen New Jersey. As for findings, we're still wrapping up the analysis of our study, but we did have a total of 10 students engaged, pre-med and medical students. We had a total of 15 ED shifts, which equated to a total of 31 hours in the emergency department. 49 patients were engaged, and 29 patients were navigated to screening mammogram appointments. The 20 patient difference there is because some of those patients were not eligible for a screening mammogram. Out of the 29 patients navigated, 13 patients were screened, which is about a 45% appointment show rate. 62% of the patients screened needed help with transportation, so we assisted them with Uber Health. Approximately 15 of the patients screened were uninsured, and again, they were connected to financial services to make sure their screening mammograms were covered, and 70% identified as Black/African American. So in conclusion, the plan is to examine screening outcomes as well, beyond the screening mammogram, so that's something our team will be looking into in the future. A future goal also will be to formally expand the program. We want to get a full-time coordinator, more navigators, and more hours so we can engage more patients. We also hope to improve our appointment show rate, eventually scale this project across the hospital outside of the emergency department. We also are hopeful to expand to other cancer screenings and are developing a pilot for lung cancer screening currently, which will be what we're working on next. And we also do want to develop a formal training curriculum to get more students involved as student-patient navigators in our project. This really has been an exciting project that our students love and are really eager to continue involvement in. And so we'll be continuing this project throughout the next year and expanding as mentioned. So thank you so much for listening. I hope this was helpful. And please feel free to reach out to us if you have any questions. Thank you so much.